third lecture of Neoplasia lecture series. This is a part 2 of carcinogenesis and host defense. Today in this lecture, we will discuss about the other aspects of the carcinogenesis, the few genes which are important for the carcinogenesis, how those genes are effective in a process of carcinogenesis, what is the host defense, how the tumor escapes from the immunosurveillance of our body, that we will see today, and the effect of cancer on our body. These are the objectives of our lecture. When there is a carcinogenesis which hits the life, that leads to cancer. So the cancer formation, the cancer development, the whole process of the cancer development is known as carcinogenesis. Now, what are the oncogenes? Oncogene, a gene that when mutated or expressed at abnormally high level contributes to converting a normal cell into the cancer cell. That means the oncogene is the responsible gene to mutate. When it mutates, it converts the normal cell into the cancer cell. What is proto-oncogene? The normal cellular progenitor of the oncogene that function to promote the normal growth and division of the cell. Now, the proto-oncogenes are the normal cellular progenitor. That means they are the oncogenes which are normal. They are functioning normal, but they are prone to get mutated, and they converted into oncogenes. So there is a difference between proto-oncogene and oncogene. Oncogenes are the mutated gene material, and proto-oncogenes are the oncogenes which are prone to get mutated, but they function normal. So when you see this in this diagram, the difference between the proto-oncogene and oncogene is been given. Proto-oncogene is a gene which lead to unregulated cell growth and overproduction or the reproduction of the cell if it is damaged. If it is damaged, then it converted into oncogenes. So oncogenes are the damaged proto-oncogenes. They will mutate, the oncogenes are the mutated proto-oncogenes, and they convert normal cell into the cancer cell. Oncogenes by location. See, oncogenes are located at a particular site in the cell. Certain oncogenes are secreted. Certain oncogenes are situated in the transmembrane. Some of them are the membrane associated but in a nuclear surface of the membrane. Some of them are cytoplasmic and some of them are nuclear. So this is a classification according to the classification of the oncogenes according to the location of that particular oncogene. Now, there is one more classification is important to know. That is a classification according to the function of the oncogene. Now, there are certain oncogenes. They have converted the proto-oncogenes converted into the oncogenes, and they function as a growth factor, like C-Cis, HSC. Some of them are situated in a cell surface, and they act as a cell surface receptor. They act as a cell surface receptor and they promote the growth, they activate the growth. Some of them are intracellular transducers. So they located intracellularly and they transduce the growth promotion. DNA binding nuclear protein. These are the certain oncogenes which gets mutated and cause some problem with the DNA repair. Regulators of cell cycles. There are different oncogenes which affect the cell cycle positively as well as negatively. So these regulators are the tumor suppressor regulators. They suppress the cell cycle, or they suppress the cell division, and that leads to the growth promotion. Now, how does oncogene work? There are normal genes which regulate the cell growth. So the drive is smooth. The cell drive, the cell growth is smooth till it it uh, it appears and it disappears. From the life to death, the cell cycle is normal. The cell growth is normal. Once the mutation occurs, the accelerated cell division occurs, and the drive strikes to cancer. So there is a strike to cancer. Certain cancer development in certain cancer development, one mutation is sufficient, and this one mutation causes the cancer. That is known as genetic theory. So these are the oncogenes. One mutation leads to accelerated cell division and strikes that cell growth drive to the neoplasia. Now, certain tumor suppressor genes, when they get mutated, they need multiple mutations. So what occurs? Like if we see the tumor suppressor gene is on the driving seat and it is driving a cell growth. What occurs then? It gets mutated. First mutation, the oncogene becomes active. Second mutation, the break fails. And third mutation, the overgrowth occurs. The oncogene becomes so active that strikes to cancer. So sometimes the tumor suppressor gene needs multiple mutations, and that multiple mutation lead to the cancer formation. So how this occurs, you see very nicely that this is a tumor suppressor gene which is sitting on a driving seat. The first mutation occurs, the oncogene is formed. The second mutation occurs, no breaks, that means the tumor suppressor effect is diluted. And then here there is tumor suppressor effect is not there, and the active oncogene is there, which strikes the drive, the cell growth drive to the cancer. So first mutation, the susceptible carrier, and second mutation, it leads to cancer. This is how the genetic and the epigenetic theory works. But one thing is there, the molecular basis of carcinogenesis is multi-step. It has multi-step. So multi-step carcinogenesis has multi-step preventive mechanism as well. So you see one thing, that there is an initiation. This is a normal cell. Here, at the initiation of the cell division, at the level of cell division, the DNA damage occurs. If the DNA repair occurs properly, then this will not promote into the growth. If this escapes from the DNA repair, then the growth promotion occurs. That growth promotion leads to progression into the neoplasia and to the malignancy, to the metastasis. Now, when we see that multiple steps, one, this is very initiative phase, then growth promotion. Here, the tumor suppressor oncogene and the tumor activating the growth promoter oncogenes are effective here. Here, what occurs? How does it progress into the neoplasia? The growth is growth suppression and the growth promotion is imbalanced. The growth is uncoordinated, it becomes autonomous and uncontrolled. So the oncogene causes the progression, it promotes and progress into the neoplasia. And then there is a mechanism of metastasis. The invasion occur, angiogenesis occur, and that leads to distant metastasis that causes malignant tumor. Now, what occurs? Whenever we do give the therapy, the multiple levels are important. At which level the therapy is effective is important to know. That's why the cytogenetics is important. If we know that there is some problem with the DNA repair, we have to give the chemopreventive agent which blocks the DNA damage. Similarly, if we know that the promotion and the progression is the step, this is the step that has caused the neoplasia, that has caused the malignancy, we can give the chemopreventive agents like it suppress the growth promotion, it suppress the escape from the apoptosis. So the apoptosis is activated and the growth promotion is suppressed by certain chemopreventive agents. When it has lead to the stage 4, the metastasis has occurred, we can or patient is about to go into the stage 4. At that time, we give certain chemopreventive agents which inhibits the invasion, angiogenesis and metastasis. So in this way, if we know the molecular basis of the carcinogenesis, the multi-step process of carcinogenesis, at that time we can uh, utilize our chemopreventive agents. If we are not knowing that what exactly the steps of the molecular basis of the cancer, then we cannot choose the proper chemopreventive agent. So to know, to give the proper therapeutic effect to the patient, we should know the process of carcinogenesis. Host defense. Now see, one thing is there, the host has certain immunity which can have a war against cancer. See, our host defense is very powerful, which gives the proper fight to the cancer cells. And sometimes they win, sometimes they don't. So, this is known as immunosurveillance theory, in which the cancer cells will escape from the host defense. That means they escape from the immunosurveillance of our body, and in that case, the cancer wins and the immunity defeats. See, these are the different host defenses like CD8 T cells, CD8 plus T cells, like cytotoxic T cells and helper T cells. Both of them are important for the host defense. Natural killer cells, certain macrophages which are having antigen presenting uh, um, efficacy. So those are also known as antigen presenting cells, and certain antibodies in our body that also a part of immunosurveillance. But what occurs? The tumor escapes from this immune response and that lead to the cancer formation. See, this is the immunity against the cancer. Multiple steps of immunity. One is natural killer cell, directly engulfs that directly engulfs the cancer cell. Directly, the cancer cell becomes inactivate if it comes in a contact with natural killer cell. Some antibodies they get attached to the antigen of the cancer cell and they give uh, this red signal to our RE system, and our RE system will destroy the cancer cells. As I've told you, the macrophages. Macrophages have antigen presenting capacity. So they present these small triangles, if you can see. These triangles are the antigens. These antigens of the cancer cell is presented on the cell surface by the macrophages. And these macrophages, which which is flagging the antigens of the cancer cell, will be helped by T helper cells or cytotoxic T cells. Cytotoxic T cell identifies that foreign antigen and it will combine with that macrophages and it secretes certain cytokines which leads to the destruction of the cancer cells. Similarly, T helper cell also do the same thing. The cytotoxic T cell, CD8 plus T cells, is directly toxic to the cancer cell, while T helper cell indirectly it secretes certain cytokines and that will destroy, that will cover the cancer cell by that antibody, and our RE system will indirectly destroy that cancer cell. So in this way, the immunity and the cancer, if we see the antibody mediated, NK cell mediated, T cell mediated, and macrophages, these are the immunosurveillance of our host defense mechanism of our body. How do the tumor cell escape from our immunosurveillance? One is a mutation. There's a mutation in an immunosurveillance mechanism. The genes which are coding, which are important for the immunosurveillance, that gets mutated. In that case, the immunosurveillance is escaped. See, major histocompatibility molecules on the tumor cell surface, if it is there, they act as an antigen, and those antigen is flagged by the macrophages. But the molecules decreased on the cell surface, tumor cell surface, the tumor cell surface will escape from the identification of the macrophage. Lack of the co-stimulatory molecules. See this, these co-stimulation molecules, they act with the major histocompatibility molecules and they make cancer cell identified by our immunosurveillance mechanism. But if it is not there, then our immunosurveillance mechanism, our macrophages, our cytotoxic T cells, natural killer cells, they will not identify the cancer cells, and thus the tumor cell will escape from the host defense. Immunosuppressive agent, if patient is on the immunosuppressive agents, in that case also the immunity is very low and tumor cell escapes from the immunosurveillance. Commonly it happens with the patient, HIV positive patient. Antigen masking by the autoantibodies and apoptosis of the cytotoxic T cell. That is, a Dept tumor cell kills the T cell itself. The T cell is destroyed once, they will lose the cytotoxic effect as well as helping effect. So in that case, the tumor cell secretes certain proteases that kills the T cells, and because of that, the immunosurveillance escape of tumor cell occur, and all these reasons can lead to cancer formation. What is the effect of tumor on the host? See, when it is located in a local part, the anatomic encroachment occurs. It goes into the neighboring tissue and it encroaches the further part of the organ. Hormone production or hormone-like peptide production occurs that leads to paraneoplastic syndrome. What is it? We'll see subsequently. Bleeding diathesis and infection is very common with the patient having cancer. Bleeding is because of certain enzymes which are secreted, certain material which is secreted by the tumor can lead to bleeding diathesis. It can lead to DIC, and DIC can lead to bleeding. And infection is due to the decreased immunity. Certain acute symptoms like rupture, infarction, maybe there is a aneurysmal formation, emboli which can lead to infarction. This can possible here, and metastasis is a very common effect of tumor on the host, and distant metastasis can lead to the cancer towards poor prognosis. Clinical aspects of neoplasia. The importance of the neoplasm lies in their effects on the patient. So what is the effects on the patient? The cancer cachexia. When you see, the patient will come with a significant weight loss if patient is having cancer. Certain local and hormonal effects, like if a patient is having the cancer in the upper respiratory tract, at the level of larynx, at the level of vocal cord, patient may come with a hoarseness of voice. So that is a local effect. And certain hormonal effects because that leads to paraneoplastic syndrome. So the paraneoplastic syndrome is also the clinical presentation of the patient. Cancer cachexia is due to decreased appetite. Patient will have fat loss, then muscle loss. This cachexia is due to tumor necrosis factor, interleukin 1, and PIF. This leads to cancer cachexia that causes the fat loss as well as muscle loss that lead to cachexia. Local and hormonal effect. Now, how does local and hormonal effect occur? Like if small benign pituitary adenoma will compress other part of the benign part of the normal gland, and which leads to hypopituitarism. Similarly, benign beta cell adenoma, which affects the pancreatic islets. So the insulin is insufficient, and that may lead to uh, insulin is insufficient, or maybe overproduction of the insulin that lead to fetal hypoglycemia or hyperglycemia. So this is a local and hormonal effect. What is paraneoplastic syndrome? This is most commonly asked short note. Is paraneoplastic syndrome? You should know what exactly the paraneoplastic syndrome is. Some cancer-bearing individuals develop signs and symptoms that cannot be explained by the anatomical distribution of the tumor or by the production of the hormone from the tumor itself. This is known as paraneoplastic syndrome. That means if patient is having some tumor, that particular uh, tumor is not giving the particular local and the hormonal effect of that particular tissue, but it gives the different type of hormonal effect that is known as paraneoplastic syndrome. That is due to the tumor cells, they secrete certain hormone like peptides, and they are not exactly the hormone, but they produce the hormone like effects. We'll see what are those effects. See, when there is a small cell carcinoma of the lung, when patient is having a small cell carcinoma of the lung, the ACTH and ACTH like substance is secreted by the small cell carcinoma tumor cells, and that leads to the Cushing syndrome. So this Cushing syndrome like effect is not due to any adrenal problem, but that is due to the small cell carcinoma. Similar effect can be seen in the pancreatic carcinoma as well. See, certain hypercalcemia. Hypercalcemia is caused by squamous cell carcinoma of the lung. Why? Because the parathyroid hormone related protein is secreted by squamous cell carcinoma of the lung. Hypercalcemia is also caused by breast carcinoma, renal carcinoma, adult T-cell leukemia, ovarian carcinoma. So these are the different tumors, different carcinoma, which causes different type of endocrine effect, but that is not due to the particular organ specific hormone, but that is due to the hormone or hormone like substance which is secreted by these carcinoma cells. This is known as paraneoplastic syndrome. You should know which carcinoma causes which type of syndrome. So when you are dealing with a cancer, it's very important to searching out and thorough investigation of the truth or to the primary study of the man. See, any of the doctor or any of you are dealing with a cancer, the thorough investigation is very important. And once you know the truth, you can investigate thoroughly. If you know the process, if you know the molecular basis, you can investigate that particular patient. If you don't know the things, you will not able to choose which chemopreventive agents has to be taken care of, or which is to be used at what time, or what particular mm, uh, theory is effective, or it is behind this cancer development, that you should know. And according to that, the host defense mechanism, where host defense mechanism is defective, that you should know. If you know this thoroughly, then you can investigate the patient and you can treat the patient in a proper way. Thank you.